Hello, my name is Jesse Philgrove. I'm a registered nurse. I chose to research music therapy's effect on postoperative pain. My PICO question is, in postoperative patients, does music therapy as a complement to standard interventions reduce pain? So let's break down the PICO. Uh, the P population is postoperative patients. The intervention, music therapy, but as a complement to standard intervention, not as a replacement for analgesic medications or other complementary therapies. Uh, so it's not taking the place of Tylenol or morphine. It's just an extra piece to use. The C, the control group, is just standard postoperative care, standard nursing care, things like pain control with medications, ice, heat, physical therapy, the normal stuff. And then O, the outcome, decreased pain. Does music intervention help to reduce pain for postoperative patients? So let's talk about the why. Why study music intervention at all? Well, of course, surgery is painful. It's known. Standard care relies pretty heavily on analgesic medications, and some of these meds can have a harmful effect on patients. Some can lead to addiction. There's all kinds of problems that can form. And actually, the Joint Commission in 2018 mandated that hospitals reduce, or at least try to minimize risk associated with pain management. Not a lot of non-pharmacological interventions can reduce staff interruption. Most require a lot of hands-on presence by nursing staff. Like, for example, ambulation, applying ice and heat. You have to switch that on and off every 15 or 20 minutes. Massage, so on. And the other great thing about music intervention is it can be self-administered. Patients can take their own devices. They can do what they want with the music. So talking about the search, I searched several search engines at first. I looked through Google to look at results for uh, music intervention on postoperative patients. I found a lot of stuff, a lot of results from more than 5 years ago. So I went into Medline and EBSCOhost through PA College, limited the search within the last 5 years, looked for full text. There were a lot of articles, but the only ones available were a couple of quantitative studies, 4 quantitative studies, and 1 quasi-experimental study. So they were pretty good. So key terms I used for search: music therapy and postoperative pain. That gave me the results I needed. Found a lot of similarities in the studies. Most looked at more than just pain. A lot looked at anxiety and depression postoperatively. A couple looked at the ability for the patients to care for themselves in general, and some looked at vital signs such as heart rate, respirations, blood pressure, and most used the same pain scale for measurement. They used the VAS scale, the visual analog scale, and that's where patients mark their perceived pain along a line graph. And this graph is usually numbered low to high, 1 to 10, 1 to 100, something along these lines. And all of the studies I included here, all of the trials, were international studies. I couldn't find any recent United States-based studies on music intervention on postoperative pain. Couple key differences. Like I said, studies were performed all around the world. There were 2 from China, one from a place called Kanshan City, and one from a university medical hospital called Shangqing University. And those are about 19 hours apart, just a 19-hour drive. So they're relatively different areas in China. The other 3 studies, one was from India, one was from Denmark, and one was from Iceland, respectively. These studies, surveyed many different kinds of surgical patients. Some were GYN, like hysterectomies, some were elective surgeries, some non-elective general surgeries, And 2 of the studies actually specifically looked at coronary artery bypass graft patients, or CABG patients. Some other differences were in like the data collection. Some surveyed only immediate post-op. So they would have the surgery and the researchers would survey them on pain within a couple hours of the surgery after undergoing the music intervention. And a couple of the trials followed patients for up to 10 days afterwards. The study from Iceland looked at patients for up to 10 days post-operatively, and the study from India surveyed patients immediately post-operatively and then again a week later. The day surgery study from Shenzhen was the only trial that surveyed patients one time, and it was 6 hours after surgery. The final main difference was exposure to music intervention. One trial had patients listening preoperatively and postoperatively. A lot of them tried to keep track of the exact amount of time that patients listened to the music for, and some did that well, some didn't. Some only did it for a set time. The study from India had patients listen to 35 minutes of music exactly while undergoing physical therapy. So the length of listening varied between studies, and also the types of music varied between studies. Some did classical, one did harp music, and actually the Icelandic trial included nature videos along with the music. Thought that was pretty interesting. So just synthesizing the literature. Of course, all of the studies recommended further research prior to implementing. I think the most patients included in one study was 112, so some larger studies could be beneficial to this research, specifically in the music intervention for postoperative patients. Some found statistically significant findings, some did not, and I'll talk about that. The Icelandic study found actually that audio relaxation techniques and nature videos along with music were the most effective for pain reduction. So engaging the whole brain, not just listening. That study specifically didn't find a significant difference between the control group and any of its intervention groups. A lot of the studies, like I said, use the visual analog scale, which is a good representation of pain, but again, most of the literature points out that music is a subjective measure, and a lot of studies, again, found that music intervention is more effective on other factors of pain, so like anxiety, vital signs. We call it the surgical stress response, but there's not always a direct correlation with pain reduction. This surgical stress response reduction was seen in both the Icelandic study and the study from India. The results in the trial from Shenzhen Hospital and the trial from Denmark had actually opposite conclusions. Their study designs were again very similar. They surveyed patients within hours of surgery, and the study from Shenzhen concluded that music was effective for pain, and the researchers from Denmark, again similar study, concluded that music was ineffective for pain management. Interestingly though, the Danish study also concluded that music reduces surgical stress response. So this kind of makes you question where the studies that concluded music was effective really just measuring a decrease in surgical stress response. I think in all this, it's important to recognize that pain is subjective, and many people experience pain differently. Some of the studies mention this as a potential for bias in results. The study from Iceland actually excluded people with a history of using narcotic pain medications or with chronic pain, which I think is reasonable, but that was not mentioned in any of the other studies, that specific exclusion. So, including all this, the results were really mixed. 3 of the 5 studies concluded that music therapy is effective for postoperative pain management. One of the studies from India in the 3 of the 5 used what I would call a questionable data collection method. Data was collected immediately after surgery and then again a week later. So of course I think a week after surgery you would see a reduction in pain. The trials from both Kenshan, China, and from Shenzhen concluded that music was effective in post-op pain management. So both of the studies from China concluded music was effective. And the study from Iceland and Denmark found no statistical significance in pain reduction. The study from Denmark outright decried music intervention and found that music was not effective in immediate postoperative, as an immediate postoperative complementary pain reduction method. So, when talking about practice recommendations, I cannot really recommend any practice changes at this time, just due to the conflicting results of the studies. A lot of patients at our institutions and in America already have access to music if they want, and they have access to alternative therapy and to nature videos with music. I know at my institution, Lancaster General Hospital, there's an entire channel just for nature videos with music for patient relaxation. There's a whole bundle of music therapy already available, even if the studies show that it may not statistically be significant in reducing pain. The takeaways, though, for these studies: alternative therapies exist. I think nursing often underutilizes alternative therapy in postoperative pain management. I did not find enough research to support changing practice in regards to implementing music therapy for postoperative patients. There is definitely a correlation between decreased pain, or at least a decreased surgical stress response, and music therapy. And as nurses, you can always encourage patients to look into it, look into alternative therapy, look into music as at least a complement to the analgesic pain medications or other sort of postoperative interventions. And like I said, a lot of institutions have access to the channels and can do this already. I just want to say thank you for taking the time to view my presentation. This was a lot of reading, and I really enjoyed this class. I think my biggest takeaway from the class was the process of research and recognizing a study with good internal validity versus a study with maybe not the best design. So anyway, thank you. I appreciate you viewing my presentation.